A lot of patients ask me, what is the difference between a brow lift and an upper eyelid lift? And the number one aging face procedure starting in the late 30s is usually something to do with the eyelids, especially since everyone's wearing masks nowadays. The first thing you look at is what? The eyes. So the eyes are the key to the soul. So with an upper eyelid lift, it means that you're making an incision on the upper eyelid and you're removing some excess skin. The thing with the brow lift is you're making incisions in the hairline. Usually we use an endoscope to make small incisions to elevate the eyebrow. So sometimes if a patient is misdiagnosed and really needs a brow lift and you take away a lot of skin, then what happens is the eyebrow even pulls down more. So it's very important to make sure you have a good exam to say, do you need upper eyelid lift or a brow lift or a combination of both? So here's an example of a patient who has asymmetric eyebrows. They're a little bit low, especially on this side, and it has a lot of heavy eyelid skin. And then here's her post-op. So she had a brow lift. She wanted more of the lateral eyebrows lifted up and the upper eyelid skin. And if you take a peek here, here she is before, and then here it is after. This patient was unhappy, came in. She didn't need excess skin removed on her upper eyelid, but she did not like this being so low. And she wanted this elevated somewhat. So here she is after. And we were able to elevate through an endoscopic brow lift the medial part of the eye, something that we rarely do. But since she was so low, that we actually were able to give her a beautiful job and show a little bit more of her eyelid, but it also show what we call medial eyelid ptosis. Right here, came up, and even a little bit laterally. No upper eyelid lift. Here's a patient, again, same one we just saw. Here she is, post-op, and you can see the difference, how beautiful the eyebrow contour is. Now, here's one of just a blepharoplasty. You can see the eyebrow is in really good position, and the eyelid skin is pretty heavy. We come back and we see the difference. No brow lift, just upper eyelid lift. As a matter of fact, the incision is right in here. So here's another example. She had a gentle brow lift. She was unhappy with the way her brows were shaped, the upper eyelid skin. She even had a little bit of fat in the lower eyelids, so we did fat repositioning and even a little bit of fat grafting. Here she is after, much more refreshed, beautifully shaped eyelid, eyebrow contour. Before, after. Here are the eyelid incisions after they're healed. Here's another eyelid incision. There is a small line somewhere in here. And then over here, this is actually a male upper eyelid. You can see that can heal well. Matter of fact, we had to throw in a male here too. Really low eyebrows, but we just did a smidgen. We wanted real conservative, real low. You can see the difference here. So you can do this. This is a little bit of older gentleman. So you can also, of course, do this in men and still keep a very natural